Good morning, everyone. I'm Dr. Sophia Lekblch. I'm an ophthalmology resident from Morocco. Today, I'm going to talk about ophthalmologic presentation of multiple sclerosis in children, a report of 3 cases. Multiple sclerosis is an inflammatory disease that affects the central nervous system. It's actually the most common neurological disorder in young adults. In children, it's quite rare. Ophthalmologic involvement can occur, and when it does, it's considered a real therapeutic emergency because of the risks of the long-term visual disability. We report 3 pediatric cases of multiple sclerosis revealed by ophthalmologic symptoms. I will now present the case of 10-year-old boy. He had a past history of transient monoparesis which resolved spontaneously. 1 month ago, he developed a sudden loss of vision in his right eye associated with the pain on eye movement. There was no history of trauma or affection. On examination, the right eye had only light perception with normal ocular motility and a quiet anterior segment. Fundus showed a temporally pale disc with the blurred margins, and the left eye was normal. The OCT of the right eye showed a marked thinning of both the retinal nerve fiber layer and the ganglion cell complex, confirming severe optic nerve atrophy. There is complete visual field loss in the right eye. MRI showed multiple brain lesions in both supra and infratemporal region with mild atrophy and enhancement of the right eye optic nerve, typical of the myelinating optic neuritis. A diagnosis of relapsing remitting multiple sclerosis was made after an extensive workup and successive MRI finding. The patient was treated with teriflunomide for 1 year. They switched to natalizumab after a relapse with increased lesion load. He has remained stable for the past 16 months. This is an 11-year-old boy with a recent history of COVID-19 infection. For the past 2 years, he has an intermittent episode of binocular diplopia. He was admitted for persistent binocular diplopia on lateral gaze for 1 month, associated with the left eye abduction palsy. Ophthalmologic examination of the right eye was normal. In the left eye, visual acuity was perceived 10-10 with the paralysis of the abducens nerve. Brain MRI with contrast enhanced T1 sequences showed multiple active lesions. On T2 images, there was a lesion involving the fascicular portion of the right sixth cranial nerve. FLAIR sequences also revealed several lesions for which enhanced after contrast injection. Cerebrospinal fluid analysis revealed the presence of original band. An extensive workup was performed, including anti-MAG antibody testing, which was negative. A diagnosis of early onset multiple sclerosis was made after the COVID-19 thus became negative. The patient received intravenous corticosteroid pulses followed by rituximab therapy. This is a 13-year-old girl with a history of recurrent rotational vertigo for 1 year. 6 months ago, she had an episode of anterior uveitis in the both eyes, which improved with topical corticosteroid therapy. Her mother has a known history of multiple sclerosis. She is currently presenting with decreased visual acuity in the left eye. The right eye was normal. In the left eye, there were signals of intermediate uveitis without posterior involvement. Brain MRI showed multiple white matter hyperintensities consistent with multiple sclerosis. The patient was treated with corticosteroid pulses, then started on the first-line therapy showing good improvement. Multiple sclerosis is rare in children, accounting for only 0.5 to 10.5 of all multiple sclerosis cases. The median age of onset is around 12 years, with equal sex distribution before age 10. But a female predominance thereafter, and environmental factors such as low sunlight exposure and vitamin D deficiency appear to influence disease risk. According to study by Banwell et al., 1,540 pediatric cases, the main clinical manifestations were motor and sensory distribution. For long-term treatment, interferons are approved for use in children, but often poorly tolerated. In 2010, the Paradigm study demonstrated the efficacy and safety for ofagolimide in pediatric multiple sclerosis. Natalizumab and rituximab have also shown good efficacy and tolerance in several cases series. Pediatric multiple sclerosis is rare, but should always be considered in children with unexplained visual or neurological symptoms. Ophthalmologic signs might be the first clue to multiple sclerosis in children. Thank you. No, just it's extremely rare, so just we have 3 cases. Sorry for English and I speak French, that's why.
So these are two tests, the animal spectral disease and the MOG.
Yes, the anti-MOG was negative and anti-AQP4 was negative, so we concluded that is multiple sclerosis.
So how did you decide for which patients to choose rituximab and for which patients to choose it?
Yes, it's activity and severity. For children, anti-reference is not tolerated, so we used teriflunomide or fangolimide. If it's severe, we pass to rituximab and natalizumab. It's a neurologist who choose the better treatment, not the ophthalmologist. Thank you.
Good data. Have you published the work or not yet?
Not yet.
No, it's really very good. It's the problem is these cases are not common, right? That's the problem. So it'd be a good way to look into them, like if from a big data.
Okay.
Yeah. No, well, excellent. Yeah.
So thank you everyone, and thanks to all the participants. Your level of presentations and research methodology all were very good. Okay, we so the winner will be announced on the closing ceremony of all the competitions. So please be there, and thank you again. Keep up your good work. Request all the presenter to be on the platform for a photograph, excluding Dr. Mazdi.
Who wins? No, you can do reading. No, I can take from the Bible.
Please come. Excellent, excellent. Very good. All the presenters. Yeah, I see the presenter. I mean, you want to know the specifics of it. It's hard to know, but I think the broad message is that spoiling good scenery is not a good idea. Yes. I think that's the broad one. No, it's just a general. Let's put the present. But this
Dr. Magli, you can come. You are professor. No, you said from the beginning I cannot come. You hurt my feelings. I can win. I didn't present, but I can win. How about that?
Yeah. Thank you. Thank you so much. Thank you. Thank you so much. But later with the trajectory, right?
أنا لسه طيب ماشي
And that were after and
There's a lecture now, so before the panel, I found
the question وانا هجيب قهوه ماشي
Dr. Ahmed Salam. Dr. Ahmed Salam. I'm calling you by name. Good morning, everybody. Before we start our panel today, we have a keynote lecture from Dr. Mohammed Zaidi, the president of the Veterinary Society in Morocco. Dr. Zaidi is a dear friend of mine. He's an eminent surgeon. He presented last year live from Morocco, the live surgery. He's a medical and surgical consultant. He's a former fellow at Paris Hospital, and he's a former senior registrar at Paris Hospital and director and founder of the Noor Ophthalmology Clinic in Casablanca. Now he's the president of the JOP Congress and president of the Veterinary Society in Morocco. He founded the CNOC Academy, and he's the president of ZD Association of Hope and Sight, and he's professor at the International University of Casablanca. He's published many research work, and he presented widely all over the world in Euratina, in Europe, and